All right, in this video, we're going to talk a little about atherosclerosis. Atherosclerosis, or hardening of the arteries, or vascular disease, is the underlying factor behind a lot of our issues, which like cardiac disease, coronary artery disease, um, strokes, and peripheral artery disease. These three combined are by far and away the number one killer of most people in the developed world. And so it's a major problem. And someone had a comment about whether this is reversible or not. And the good news is it is reversible, actually. So here's a paper talking about, so usually the way that coronary artery disease is managed when it gets severe in the United States is you either get cardiac stents or you get cardiac bypass surgery when it gets bad enough. And until people get put on statins and things like that, until they get to the point where it gets bad enough that they need stenting or bypass surgery. So what it shows is that you can reverse atherosclerosis. Yeah, at least partial reversal has been demonstrated unequivocally with the use of intravascular ultrasound. And reversal requires control of all major cardiovascular risk factors. This includes smoking, hypertension, diabetes, dyslipidemia. And so what they want is they want people to change their diet. And usually most standard protocols involve using statin drugs. So simvastatin, atorvastatin, these are drugs to control your LDL cholesterol. And that is, statins are very effective in that manner, but there's a lot of bad side effects of statins, which I personally would avoid statins for those reasons, mainly being a loss of muscular strength and long-term effects on things like muscle strength, which is muscle strength is one of the prognostic factors in early death in the elderly. So, is there a better way to do it? Yes, there is. And I'd like to go over this one paper written by Caldwell Esselstyn. He's a cardiothoracic surgeon out of the Cleveland Clinic, and he's done a lot of work on this. And so let's read this because it's very interesting, actually. A 1999 autopsy study of young adults in the U.S. between the ages of 17 and 34 who died from accidents, suicides, and homicides confirmed. So these are young, healthy people, ages 17 to 34. They died of the reasons that young people die from, which is usually homicide, suicide, or car accidents, or some other kind of accident. And when they looked at their coronary arteries, they found out that it's ubiquitous. That means pretty much everyone had coronary artery disease. When they looked at U.S. casualties during the Korean War, almost 80% of soldiers at the age of 20 had coronary artery disease. This was like during the Korean War, 1950s. So that was a long time ago. More recently, it is clear that basically almost everyone by the time they finish high school has coronary artery disease. The start of atherosclerosis has happened in usually healthy people. Yet medicine and public health leaders have not taken any steps to forestall or eliminate the early onset of this epidemic. Smoking cessation, a diet with lean meat and low-fat dairy, and exercise are generally advised. So this is the standard thing that everyone is told. Don't smoke, eat a diet with lean meats, low-fat dairy, and exercise. But cardiovascular disease remains the number one killer of women and men in the United States. The question is why? Unfortunately, such dietary measures do not treat the primary cause of cardiovascular disease. The same can be said of commonly prescribed cardiovascular medications such as beta blockers, angioconverting enzyme inhibitors, angiotensin receptor blockers, anticoagulants, aspirin, cholesterol-lowering drugs, and medical interventions such as stents and coronary bypass surgery. So these are all like kind of ways of masking the problem, but they don't get to the root of the problem. It is increasingly a shameful national embarrassment for the United States to have constructed a billion-dollar cardiac healthcare industry surrounding an illness that does not even exist in more than half the planet. If you, as a cardiologist or cardiac surgeon, decide to hang your shingle in Okinawa, Papua New Guinea, rural China, Central Africa, or the Tarahumara Indians of northern Mexico, these are the Indians that are the subject of a great book called Born to Run. If you haven't read that book, it's a great book. But anyways, you deserve a plan on you better plan on a different profession, because these countries generally have such low rates. These areas have such low rates of cardiovascular disease that you probably will be out of a job as a cardiologist or cardiac surgeon. This is unfortunately rapidly changing as the Western diet and KFC and McDonald's move into these areas. Their rates of cardiovascular disease are going up. The common thread is that in these areas, people all thrive on a whole food plant-based nutrition. So whole food plant-based nutrition means you just eat plants, like you would see if you were on a farm, like not processed plants. So not like like Beyond Burger or what is that, Impossible Burger, not that kind of stuff. This is like plants, like like corn and zucchini and kale and beans and nuts and seeds, like you would just see from a farm if you lived on a farm, not packaged or processed in some industrial factory. By way of contrast, in the United States, we ignore cardiovascular disease inception initiated by progressive endothelial injury, inflammatory oxidative stress, decreased nitric oxide production, foam cell production, decreased endothelial progenitor cell production, and development of plaques that may rupture and cause myocardial infarction or stroke. The series of events is primarily set in motion and worsened by the Western diet, which consists of added oils, dairy, meat, fish, fowl, and sugary fruits and drinks, all of which injure endothelial function after ingestion, making food a major, if not the major, cause of coronary artery disease. In overlooking disease confirmation, we often implement therapies that have high morbidity and high mortality. So instead of treating this root cause, what we do is we do things like give people all kinds of medications to treat their high blood pressure and their cholesterol with statins and ARBs and ACEs and anticoagulants. And they include a lot of risk factors. These side effects of these cardiovascular drugs increase risk of neuromuscular pain, brain fog, liver injury, chronic cough, fatigue, hemorrhage, erectile dysfunction, all kinds of bad things. So then you start getting medications to treat the side effects of the first medication, which is kind of a cycle. And surgical interventions are fatal for tens of thousands of patients annually. Each year, approximately 1.2 million stents are placed with a 1% mortality rate. So if you're placing 1.2 million stents and 1% of people are dying, that's 12,000 people dying from the stents. And then 500,000 bypass surgeries are performed with a 3% mortality rate. That's another 15,000 deaths. So he's saying that about 30,000 people die from these two procedures alone. It is as though in ignoring this dairy, oil, and animal-based illness, we are wedded to providing futile attempts at temporary symptomatic relief with drugs. And so inevitably, when people undergo stents, if they continue their lifestyle, they will get progressive atherosclerosis in other vessels, and then you'll get the disease in another vessel again. The one that hasn't been stented. So basically, the rest of this article goes on, and he talks about how he's run multiple studies. So he conducted a second largest study of 200 patients. Of these, 119 had undergone a prior coronary intervention, such as bypass surgery or stents, and 44 of them had previous heart attacks. So these were people with serious cardiovascular disease. And they had multiple comorbidities, including hypercholesterolemia, hypertension, obesity, and diabetes. During 4 years of follow-up, 99.4% of the participants who adhered to the diet avoided any major cardiac events. And angina improved or resolved 93. And in his original paper, basically, they did angiography and conclusively demonstrated that the plaques got smaller. Now, did it go away completely? No, it didn't. But it got a lot smaller. And so it's reversed, not fully reversible, but significantly reversible. In 1990, Ornish utilized, so Dean Ornish is a physician out of University of California, San Francisco, a very highly respected medical center, utilized a low-fat vegetarian diet without added oil and stress management to arrest cardiovascular disease and reverse angiographic disease, which was confirmed in subsequent publications. So anyways, here's the diet. And And the thing is that reversing coronary artery disease and atherosclerosis is hard. It requires a very aggressive change in diet. And the diet that is used in his study is a diet that has no animal products. And so that means no dairy, no fish, no chicken, no red meat, um, no butter, no cheese. And here's the so that part is like you would say that's like a vegan diet, and it's not only a vegan diet because Twinkies and Diet Coke is a vegan diet, but it's like a vegan diet that you have to use plants as if you're a farmer and you're getting the plants from your farm, your garden outside. So it has to be plants that you can recognize by looking at it, not processed plants, not plants that have been recombined and extracted into some product. Okay, and the hardest part of his diet to follow is that you can't add any oil. So you can't add, in his diet, you can't even add olive oil. No olive oil. You can't cook with oil at all, which is very hard. It's very hard to cook without oil. So I would say that me personally, I try to follow a diet for the most part that is a whole food, plant-based diet, avoiding meats and fish and chicken and dairy. And for the most part, I'm not a real strict stickler about it, but I probably have meat maybe a couple of times a year and cheese maybe a couple of times a month, that kind of thing. But I try to avoid it. But the no oil thing is kind of hard. And and I certainly use oil when I cook. But many people have questioned, like, olive oil is a good oil. Most people consider olive oil to be a good oil, and how come we can't use olive oil? And his response to that generally is like, I don't know if olive oil is good or not, because the way I ran my study, I did it with no oil. And if you want to use olive oil, you should run the study that includes olive oil, and maybe you get the same result. Maybe olive oil is just as good. I think a lot of people believe that just having olive oil would be just as good. But basically, atherosclerosis and coronary artery disease is reversible. But what it takes to reverse it is a dietary change that most people are unwilling to do. Um, but the diet that is recommended is a very healthy diet, um, and it would not only reverse atherosclerosis, it would most likely be good for most of the other chronic diseases that we deal with, which are obesity, diabetes, high blood pressure, liver and kidney disease. Most of those are caused by a poor diet as well and a lack of exercise. This diet would be great for diabetes, great for weight loss. I mean, if you eat a whole plant-based diet with no added oil, 100% you're losing weight. There is no way that you're gaining weight on that diet. That diet has so few calories and has so much fiber and has so much micronutrients that you can't gain weight. You cannot maintain an obese body on that diet. But it is a very difficult diet to follow. But there's lots of if you're interested in following that diet, it's highly recommended by most physicians, and I certainly recommend it. And there are uh, lots of resources on the internet for recipes of whole. You just have to search for like whole plant-based diet, whole food plant-based diet, and you will see lots of great recipes on following that diet. All right, so I hope this was helpful. I will link this study below. I recommend that you read it, and it is ubiquitous. Like everyone, we all have coronary artery disease to one extent or another, and so this is something, and it is the major cause of death in the developed world, and so it is something that if you're interested in your health, it is something that we should pay attention to. Okay, well, thanks for watching. I hope this was helpful.